Coping with COVID, updates on the pandemic and information to help you thrive and survive COVID-19. It's brought to you by the South Carolina Department of Health and Environmental Control. Visit scdheck.gov for an updated list of testing sites and important information on how to protect yourself, your family, and friends from the coronavirus. SCDHEC, healthy people, healthy communities. In it together and the South Carolina Diabetes Advisory Council, presenting Wellness Wednesday every Wednesday on Coping with COVID. The City of Columbia Office of Business Opportunities, helping to meet the needs of small, minority, and women-owned businesses in the City of Columbia. Log on to columbiasc.net/OBO. Agape Counseling and Training Services. Call 803-779-2777 for licensed professionals of counselors and social workers helping families, engaged and married couples, and individuals of all ages gain an understanding of all aspects of their lives. If you're having a challenge coping with COVID, contact Agape Counseling and Training Services at agapects.com. And Palmetto Media Connections, connecting media and communities together. Coping with COVID, brought to you by SCDHEC. In it together, the Diabetes Advisory Council, the City of Columbia Office of Business Opportunities, Agape Counseling and Training Center, and Palmetto Media Connections.
Coping with COVID with Tre Tailor.
Fight the spread and take a stand against coronavirus. Wear a mask in public. Stay at least 6 feet apart from others. And get tested. Join us and fight the spread. Visit scdheck.gov/COVID-19.
Happy Thursday. I'm Tre Tailor, and you are watching Coping with COVID, updates on the pandemic and information to help you thrive and survive COVID-19. It's brought to you by SCDHEC, the City of Columbia Office of Business Opportunities, In It Together SC, the South Carolina Diabetes Advisory Council, also Agape Counseling and Training Services. Listen, if you're having some challenges coping with COVID, please contact the folks at Agape Counseling and Training Services. Coping with COVID is also brought to you by Palmetto Media Connections, and we're so glad to welcome two new sponsors. The Comet Bus System. Don't forget that the Comet Bus System is offering free rides to get your COVID vaccine. Don't miss your shot. Catch the Comet to get your vaccine. We're also being sponsored by the great folks over at Computers Unique in Dutch Square Mall. Contact Daniel for sales and service of your computer or laptop for fast, professional, and reliable service that you can trust. Contact Daniel at Computers Unique in Dutch Square Mall. Well, are you already having allergy symptoms like me? Scratchy throat, runny nose, headaches, red eyes. Well, 'tis the season for allergies, and experts say this is going to be one of the worst ones yet. But never fear, Dr. Nicole Edwards is here. She's going to explain why it's going to be like that this allergy season and what we can do about it. Thank you, Cole. We appreciate you coming today.
Thanks, Tre, for having me on. You know, I love to be on Coping with COVID.
And I love for you to be on. Thank you so much. Can't wait to talk to you. Plus, Brenda Blackstock joins us from SC Thrive. She's going to have some great information for seniors. Thank you, Brenda.
Thank you for having me. I'm excited.
I'm excited too. Looking forward to all of this great information for our seniors. That's coming up next on Coping with COVID. But first, your COVID community updates. In-person inside visits are now allowed at South Carolina nursing homes, specifically any facility that has no COVID cases in the last 2 weeks and have at least a 10% positivity rate. Now, in South Carolina, this applies to 40 out of the 46 counties. Those excluded, meaning these are the counties that you cannot have in-person inside visits: Allendale, Barnwell, Chesterfield, Lancaster, McCormick, and York. All of the other counties in South Carolina, you can now do in-person inside visits at South Carolina nursing homes. University of South Carolina will host in-person commencement in May and December of this year with COVID protocols in place. Officials say each graduate will be allowed 5 guests, plus social distancing and mask requirements are required. More than 63,000 students will graduate from the Columbia campus this May and over 8,000 from the statewide USC system. And President Biden will address the country today on this COVID-19 one-year anniversary. Can you believe it's been 1 year? During his first primetime speech since assuming the office of president, he's expected to honor those on the front lines, pay tribute to the over 500,000 people who died due to the pandemic, and encourage Americans about an optimistic future. Now, the speech is only 15 minutes. It'll air at 8 o'clock on all major networks and streaming services. SCDHEC has your most up-to-date list of times, dates, and locations for COVID vaccines and testing in and around South Carolina. Visit scdhec.gov for more information. Now, if you do want to get a COVID test, several places you can go in addition to the DHEC locations. And all of that information, as a matter of fact, will be scrolling at the bottom of the screen throughout the show. You can visit gogettested.com. In 4 states, you can log on, find out where there's a test, make an appointment, and get your results in about 48 hours at gogettested.com. Now, the DHEC Care Line is available for you to get information about COVID, testing, transportation, and to organize a COVID screening in your event or in your neighborhood. Speaking of transportation, if you live in Richland or Clarendon counties and are immobile, not able to get out to get a test, those paramedics in Richland and Clarendon counties are all actually doing in-home COVID screening. So call 911 for more information. Several places doing COVID vaccines now that folks 55 and older can get the vaccine. Lexington Medical Center, they are doing COVID vaccinations. Also, if you are a veteran, you can get your COVID vaccination at the VA. Again, that information is on the screen. Several pharmacies are offering COVID vaccinations. Kroger pharmacies are offering COVID vaccines. CVS pharmacies are offering COVID vaccines. As a matter of fact, Target is going to start offering COVID vaccines in the locations that have a CVS pharmacy. Not only that, if you are a senior and need some help registering for the vaccine, there is a website right there, a number you can call to get set up. Seniors who need help making your COVID vaccine appointments can call Get Set Up, and someone will be there to walk you through it. As we said earlier in the show, the Comet bus system is also offering free transportation to anyone who wants to go get their COVID vaccine. Don't miss your shot. Catch the Comet to get your vaccine. Now, the NAACP Housing Assistance Program is still up and running. They have housing navigators that can help you find the resources you need to help save your home or your apartment. Also, the South Carolina Bar Association and SC Legal Services have collaborated on a toll-free number and website. There, too, you can get several resources available if you need help with your rent or mortgage. The City of Columbia 6-month payment plan is continuing. If you need help with your water bill, you can get up to 78% paid. Plus, they are extending payments out for 6 months. The Central Carolina Scholarship Fund is closed, but grants are still available. Log on to the website. If you have a nonprofit, they have several grant programs available. Check that out. Rashonda Pratt's YouTube channel is still up and running. If you need help with your working virtually or schooling virtually, check that out. And also open enrollment for the ACA, Obamacare, Affordable Care Act, happening right now through May. You can go to signupsc.org. There's a phone number. You can go to healthcare.gov. Several ways you can sign up for free if you need some health insurance. Now, if you need a JOB, rapid reliable testing has job openings in South Carolina. Go to rrtesting.com and find out about the various job openings they have. And also, it's March, so it's Women's History Month, and the WNBA have a Woman of Color t-shirt and hoodie that they are promoting. Proceeds go to the National Council of Negro Women. It's a great t-shirt. As a matter of fact, when you go on that WNBA website, they've got a lot of different t-shirts that are really amazing. So go over there and check that out. Black Lives Matter is actually offering a scholarship fund for African Americans if they're paying special attention to parents, caregivers, transgender people, and those who are ex-offenders. You can get a $1,000 scholarship from the Black Lives Matter Fund. And there are a couple of conferences I want to tell you about. The South Carolina Legislative Black Caucus is having a minority business conference. This is going to be tomorrow from 10 until 1:30. Now, this is going to be a great conference, and it's going to talk about the opportunities for not only HBCUs, but small businesses, a little bit larger businesses, and the minority forecast. So if you need information, resources, and sage advice, please check out this minority business conference that's happening tomorrow on social media. Also, AKA Day at the State House, the Alpha Kappa Alpha Sorority Incorporated have put together a great forum, including Vince Ford, Dr. Linda Bell are going to be there. That's Monday evening at 7 o'clock. All of the information you need to know about the COVID vaccine. And we need as much information as we can get. Go ahead and check that out. All of this information will be scrolling at the bottom of the screen throughout the show, so you can get it at any time. I'm Tre Tailor. You're watching Coping with COVID, updates on the pandemic and information to help you thrive and survive COVID-19. We are streaming live on Facebook on the Tailor Made production page. That's the home of Coping with COVID. Would you please go over there and like, share, follow, and post this information out so we can get the message to the masses. We also are streaming live on YouTube. I want to say hi to all of you YouTubers. Please hit the subscribe button so you can get notified when we go live about what is happening in our state, in our country, and in our world. So don't forget also to post and share this information out so we can get the message to the masses. We are just here to provide credible information via social media in a medium that is inundated with fake news, innuendo, and rumors. So please continue to post and share this information out, because it's the folks who, a lot of times like us, Black and brown people, are just not getting the correct information because we are getting our information from oftentimes sources that are not credible. So please continue to post and share this message out, and let some folks know that this is where they need to come to get the information they need. I want to say hi to Juliet Green. Thank you so much for joining us, Juliet, and thank you for posting and sharing. And I did get your envelope yesterday. I just hadn't had a chance to open up my mail, but I'm going to do that this weekend. So listen, experts say that this will be the worst allergy season between COVID and people being indoors more. You may be, like me, experiencing sneezing, coughing, headaches, and watery eyes. To help us through it, board-certified general practitioner Dr. Nicole Edwards joins us to talk about the allergy season. Hey, Dr. Nicole, how are you?
Hey, Tre, I'm great. How are you?
I love doing great. I love your hair. It looks really good today.
Thank you.
Listen, why is this going to be such a bad allergy season?
Okay, so basically what's going on is, let's start off. Allergy season is usually sometime between about April and there are different types of allergy seasons, first of all. So the ragweed season is what we're generally talking about when we think of allergies, okay? Mm-hmm. So allergies usually go from about April-ish till about October-ish, right? But what we're seeing this year is that they've already started, like back in February. We had already gotten allergy symptoms.
Yes.
And then what they saw, it was even last year, it went way past October. In fact, we saw allergies actually going all the way, ragweed, all the way through December. And so why? What's going on? So about a month ago, so the American Academy of Allergy and Immunology, they came out and said, what's happening is because of global warming, we are having warmer temperatures. We are having more rain, right? And so we're having wetter, just wetter environment in general, and that's producing more ragweed and more allergens. Okay, and so it's warmer and it's wetter, and so we usually don't get warm until around April. Not here in South Carolina,
right.
But everywhere else, right? We get ours early, but everywhere else doesn't usually get theirs till April. But that's what's happening is global warming, and so since it's warmer out, it's the pollen, it doesn't know, okay, it's not springtime yet. So it's coming out earlier. It's also coming out harder than ever before. And so we've got more pollen, more ragweed, more of all of those. There's grass pollen, there's tree pollen, there's all kinds of different pollen, but they're all here and they're all kicking our butts.
Wow. I want to say hi to F. Maxine Moses. She said she's experiencing all of the above. Superior Edwards, your honey pie, says, hey, Dr. Nicole, you're looking good. Didn't he tell you that this morning?
Of course he did. All the time. My biggest fan.
Yes. And also Ann Hamilton is watching. Thank you guys so much for joining us on Coping with COVID. Please share and post this information out because there are a lot of allergy sufferers like me. And it was so funny because like you were saying, it just didn't hit me that it was allergies because it was so early in the season, so that was the thing. Now, here's the other thing that I heard, Dr. Nicole, that COVID is affecting allergies because people are inside more and maybe haven't change their air filters. And so that funky air that, it's just kind of recirculating in your house. Is there any validity to that?
Absolutely. So you're supposed to change your air filters anyway, about quarterly, but most people don't remember to do that, right? Unless you're a really bad allergy person anyway, and then I got to change these filters. But yes, and so because we're indoors more, we've got to remember to change your air filters. Here's the other thing. Right now with COVID, your symptoms from allergies, you don't know if it's allergy symptoms or if it's COVID symptoms. Exactly. And so the last thing you want to be doing right now is sneezing, because as soon as you sneeze, what does everybody do? Give you the dirty eye, right? They're looking you up and down.
Absolutely.
And plus you don't want to be scratching your nose. You certainly don't want to be rubbing your eyes. You certainly don't want to be Have you ever heard anybody who does that all the time?
Yes.
Yeah, it's usually well, okay. But I hear people doing it all the time, and I'm like, boo-boo, I want you to get your allergies checked, right? Because that's coming from postnasal drainage. So it drains back down your throat and it irritates your throat. Anybody ever wake up with every morning they kind of have a little scratchy throat or a little throat irritation? It's because of postnasal drainage.
Okay, yeah. I know it because my sinus passages I have headaches, right through here, right in my sinus passages. And that's when I realized, I was like, okay, these are my sinuses. I don't have high blood pressure. You know what I'm saying? You kind of start checking off the things that it's not,
Right.
You also made a great point that I want to key in on, which is differentiating between, do I have COVID and do I just have some allergy issues?
And without a test, there's no way to know. So if you're having sneezing and coughing and congestion, and definitely if you're having loss of taste or smell, could it be COVID or could it be allergies? It could be either one. So to be on the safe side, if you get some symptoms, go and grab a test. It's scrolling on the bottom of the screen, all the places you can go get a test, right? Go get a test. It's better to know than to not know. And even if you've been vaccinated already, still go and get a test, because you can still possibly spread it if you get it. You just might not be reacting as bad, but go and get tested, right? But these symptoms are so similar.
Yeah. Superior said that we should probably change our air filters even more now during COVID. Does he know what he's talking about?
Absolutely. I think he knows a little bit. He might be listening to me a little bit, but yes, you should, because we want to capture all of those germs and all of the things that are being filtered out anyway. We want to change that out. You don't want stuff to just be sitting in the filters and then recirculating. So yes, change out your filters.
We're talking to Dr. Nicole Edwards on Coping with COVID today. We've been talking about allergies and why this is so much of a bad allergy season. I want to say hi to Mitchell Peace Joy Jen. Mitchell, I'm going to get to your question in just a moment. Is wearing masks, Dr. Nicole, hurting or helping allergies?
Two things. That's such a loaded question. It can help. One of the things that I tell my patients that suffer with allergens is that either one, stay stay from outside when it's not allergy, when the allergies are at their highest, which is usually early in the morning between 7 a.m. and 10 a.m. and then around dusk, between 5 p.m. and 8 p.m. So stay from outside during those key times. But if you are going to go out, wear a mask. Now, this was even prior to COVID. I used to tell people you have to wear a mask because it helps to not let those allergens get in, and so you're not breathing them in. So great, wear your mask. That should be perfect, right? Everybody's wearing a mask. Here's what I've also heard people do though. Oh, I can't wear my mask because I'm so stuffy and congested that I can't wear it. Okay, well, if that's the case, then you need to actually be treating your allergies and treating the congestion and treating the rhinitis is what it's called. And you got to treat that. They've got nasal sprays, they've got antihistamines, they've got all kinds of other medications. But so whereas it does help to block the allergens, it can be a little bit harder to breathe when you have your mask on also.
You know what I saw on Amazon yesterday? I don't know if you've ever seen this. It's this a plastic thing that you put on your face and then you put your mask over it and it kind of helps the mask poke out some. Have you ever seen that? I've never seen that. I was looking, who knows what I was looking for I was looking for essential oils. And so I saw that it's a plastic thing that you put on your face and then you actually put your mask over it and it kind of elongates or, I know pook out. I don't know if that's the right word, but it kind of helps your mask pook out so that you have more room
right. So breathe. It's not adherent to your nose.
It's just on your nose. Yeah.
As long as it's got a good seal, I guess that would still be okay.
Yeah. I want to say hi to Alex Wright, who is watching. He wanted to get a suggestion. And Alex and Mitchell, we're going to get to that because Nicole actually has a line of allergy medicine that I want to talk about. But how long is allergy season typically, Nicole?
So typically it goes from April till a ragweed goes typically from April until about September, October-ish. Mm-hmm. But now, like I said, last year we saw it go from as early now, and I should also say in South Carolina, we start getting the pollen on our cars usually around March-ish.
Yes,
right.
Yes.
But sometimes that could even be February. We saw pollen on ours about 2 or 3 weeks ago. So that yellow stuff that's all in your car.
The yellow stuff.
Mm-hmm. Mm-hmm. So, but it's usually from about March, April to about October.
Yeah. Mitchell Peace Joy Jen wanted to know about natural remedies. For example, what do you think about drinking more water or using a neti pot?
Yes. Perfect. So drink more water. That helps to lubricate all of your nasal passages, helps to lubricate your throat. It helps to flush things out because we want to keep things moving, keep things flushed. So excellent idea. A neti pot is also good. Neti pot is a pot. It has water in it. You put it into one nostril and it basically goes in and it rinses out your sinuses, and then it comes out the other nostril. So those are great. Other natural things that you can do to help with allergies. Tre, you just mentioned essential oils. So essential oils, if you are smelling things like eucalyptus, peppermint or spearmint, any type of spearmint. Yeah. Lemongrass is also a great one.
I love lemongrass.
Yes, lemongrass is a great one. And then I say eucalyptus. These are the ones that help to just
tea tree oil. It's tea tree oil.
Yep, and those help to open up the nasal passages. And then you also want to do things that are bringing down inflammation. So one of the best natural supplements to bring down inflammation is something called bromelain. That's spelled BROMELAIN. Okay, bromelain decreases the swelling in your nasal passages. Okay, and so it's great. People say, "Oh, I can't wear my mask because I'm too congested." Get you some bromelain. Okay, there's also something called quercetin. Quercitin. Quercetin helps to decrease inflammation in all of your respiratory. So in your lungs, in your nasal passages, in your throat. So a combination of quercetin and bromelain is probably the best thing you can do. Okay. Wow. Because that decreases the nasal passage swelling and the airway passage swelling. Mm-hmm. And it's all natural. So you're not going to have the side effects that you would get from your antihistamines, like the fatigue and the dry mouth and the dry eyes that you can get from some of the antihistamines.
And that's the thing, Nicole, about doing a lot of medicines and over-the-counter stuff is that they knock you out. You're sleeping and, so you can't have an active day and take these kind of medicines. Now, I know you have a line. Does your line, does it have the bromelain in it that you were just talking about?
Bromelain and the quercetin, yes. So I have a line that's called Abundantly Natural, and it's all natural supplements. And it's some supplements, and it's things that I put together. So these are, I put these things together. So my Allergy Essentials there, it has bromelain, it's got quercetin, it's got some stinging nettles, it's got something called N-acetylcysteine. All of these things all by themselves are anti-inflammatories. You throw them all together, it's like the best thing. So what I tell my patients is you can take these, of course, always check with your doctor before you take any type of supplement. But these would not have any side effects in terms of, like I said, the same things that the antihistamines have. So you're not going to have the dry eyes, the dry mouth, the fatigue. And you can take these a couple of times a day. I take 2 every morning just because I live in South Carolina. And, South Carolina was on the top 30 of the worst states to live in terms of allergens. And then, Columbia was on the top 20 of the worst cities to live in the United States when it comes to allergies. So anyway, I pop 2 of these every morning. And then as I'm going throughout the day, I might take another 2. Like if my eyes start itching or bothering me, I might, usually maybe once or twice a day. It takes care of everything.
Well, that goes to Alex Wright's question. He wanted to know what to suggest for nasal relief, a nasal relief or a pill. So this would help with the nasal relief.
Absolutely. Correct. So this one would help. Also, like I said, the essential oils. So getting a diffuser and putting, like I said, the
oils and
the oils in the diffuser. Also, there are some over-the-counter medications as well that you can do, like the Flonase. Flonase helps to decrease some of that swelling as well. I will tell people, be very careful when it comes to things like, what's the other, Afrin, okay? Afrin can bring down some swelling, but if you use it for longer than 2 days, you can actually get more swelling. You get what's called rebound swelling.
Oh, really?
I know these people who use Afrin like every day, that's because you're causing rebound swelling because it causes, don't use Afrin for more than 2 days, all right, because it causes more swelling in your nasal passages.
Wow. This is Dr. Nicole Edwards. She's a board certified general practitioner based in Columbia, South Carolina. And she's telling us about how to deal with allergies. It's one of the worst allergy seasons ever. And as Nicole just mentioned, not only South Carolina, but Columbia is on the list of having a lot of allergens. So if you are experiencing allergy symptoms, you're not alone. We're all dealing with it. So what about runny eyes, sneezing, coughing, and headaches? Is this the same thing for all of those symptoms?
It is. It is. So I will tell you guys on, I think that was Friday, when my eyes were so red, my daughter was like, "Oh my gosh, mommy, are you crying?" My eyes were so red.
My God.
And so I had to pop a couple of Allergy Essentials to get the itching to go down. But yes, this can help with that. There are also specific medication eye drops that you can do. There's Azastilin has an eye drop. There's another one. There are specific allergy eye drops. Of course, you want to be lubricated. Somebody earlier had talked about water, drinking water. So yes, drinking water is a big one. When somebody asks how much water should I be drinking, take your weight divided by 2. That's how many ounces of water you should get a day minimum. All right. But you can also get lubricating eye drops. So like just your regular old, what do you call those things when people wear contacts?
Saline solution.
Saline in the eyes can also help with some of the redness from some of the itching. And then the last thing obviously that you want to do, you don't want to touch your eyes. You don't want to be rubbing your eyes. Okay. So there was another show I did a couple of weeks ago, and they were saying, are glasses better? Almost, because they keep you from touching your eye. If your eyes are irritated too, don't put your contacts in. Okay. Go ahead and wear your glasses that day. And then just make sure that you are not touching your eyes. And if you are, wash your hands, hopefully beforehand, or get you some hand sanitizer.
Yeah, you made a good point about the contacts. I was telling Dr. Anika that yesterday, that I can tell, like sometimes I will fall asleep in my contacts or I'm too lazy to take them out. I don't know which one, but it depends on whatever the day is. But I can tell when I take out my contacts, it's like, it's a relief because my eyes are able to breathe, So I know that, and the other thing is, and you made a good point, I didn't think about this, probably because there are irritants, allergy, pollen, whatever, on my contacts or on that you're keeping on your eyes. So it's like, it's right there. So you need to take your contacts out to let your eyes breathe and to get the allergens off of your contacts and off of your eyes.
Absolutely. And then with Dr. Anika, what she taught me was, not yesterday's show, but Dr. Anika taught me, ladies, we need to be taking our eye makeup off every day. I know sometimes we want to be staying glamorous, right? And sleep with it. You got to take it off every day because, again, those allergens can actually get onto things like your eyelashes or get onto your eye makeup. Take that eye makeup off every day so that it decreases some of the allergy symptoms to your eyes.
And you got to change your clothes. If you're outside and all the allergen stuff is on your clothes and then you come inside, you're constantly breathing that stuff in.
Yep. So and your pets too. If you have pets and they're going out, it gets into their hair. So you want to make sure that your pets are give them a bath and get the allergens out of them too. Again, change those filters.
Yeah. These are such great tips that I think we just don't think about when it comes to allergies. I think we think of the main thing is how do I get relief, but we don't think about what other things we need to do to help prevent us from even having the symptoms at all. Folks can go to Dr. Nicole's website, drnicoledo.com, to find out about her Allergy Essentials, which you can see right there. And Nicole, you're giving everybody a discount today. Tell us about that.
I am. If you use the coupon code SPRING, SPRING, I will tell you now, it'll probably be, the code will work in probably the next 30 minutes or so. I got to go put it on. But if you use the coupon code SPRING, I'm going to give everybody watching today a 20% discount off of any product that has to do with allergies on my page. So Allergy Essentials, I got a whole allergy bundle. So anything that has to do with allergies, go ahead and get your 20% because you are coping with COVID with Tre Tailor watcher. So I'm going to give you 20% off.
That is so great. Thank you so much. So go to drnicoledo.com and check out the Allergy Essentials. She actually has a whole line of supplements: women's health, trauma and injury support, thyroid support, pain and inflammation, stress, seniors health, sexual health, sinus and ear support, nervous system support, mood, men's health, mental function, immunity, liver, lung, Lyme disease, hormone, hair, skin and nails, eye health, energy, blood pressure, bone, cardiovascular, allergy, children's health, and adrenal support. So if you go to the website, check out all of the products that Dr. Nicole offers for several different types of issues that you might have. Go to the website and don't forget to put in the coupon code SPRING for an additional 20% off Dr. Nicole's essentials. And they're all natural, as Superior said. Thank you, Superior, so much. All right. So that's Dr. Nicole Edwards. She's a board certified general practitioner based in Columbia. She's currently accepting patients. Aren't you, Nicole? You still accepting patients?
Yes, I am. We don't take insurance. So we're affordable. We're cash based. You don't have to have insurance, although I can give you a super bill to send to your insurance, but we don't take insurance. But we're very affordable, and we are taking new patients for either televisits or in-person visits, and we're very careful and COVID precautions, of course. But yes, we are taking new patients.
All right, give her a call, check out the website. And of course, if you need information on her allergy product line, you can go to the website, drnicoledo.com. And don't forget, SPRING is a 20% coupon code. Go ahead and post and share this information out because we need all of our allergy sufferers need this information. Nicole, thank you as always so much for joining us today on Coping with COVID. Always a pleasure to see you. And I appreciate you coming on.
Thanks so much for having me.
All right. Thank you. Thank you so much. Great information from Dr. Nicole Edwards. Coming up, we've got more great information and resources for seniors. Are you a senior citizen? Do you know a senior citizen? Well, SC Thrive has an amazing program that really supports seniors. Great information. And Brenda Blackstock with SC Thrive is going to join us next for that. That's next on Coping with COVID. I'm Tre Tailor.
Coping with COVID, updates on the pandemic and information to help you thrive and survive COVID-19. It's brought to you by the South Carolina Department of Health and Environmental Control. Visit scdheck.gov for an updated list of testing sites and important information on how to protect yourself, your family, and friends from the coronavirus. SCDHEC, healthy people, healthy communities. In it together and the South Carolina Diabetes Advisory Council, presenting Wellness Wednesday every Wednesday on Coping with COVID. The City of Columbia Office of Business Opportunities, helping to meet the needs of small, minority, and women-owned businesses in the City of Columbia. Log on to columbiasc.net/OBO. Agape Counseling and Training Services. Call 803-779-2777 for licensed professionals of counselors and social workers helping families, engaged and married couples, and individuals of all ages gain an understanding of all aspects of their lives. If you're having a challenge coping with COVID, contact Agape Counseling and Training Services at agapects.com. And Palmetto Media Connections, connecting media and communities together. Coping with COVID, brought to you by SCDHEC. In it together, the Diabetes Advisory Council, the City of Columbia Office of Business Opportunities, Agape Counseling and Training Center, and Palmetto Media Connections.
Coping with COVID with Tre Tailor.
Every cookie sold in the Girl Scout Cookie Program helps girls learn lifelong lessons in people skills, decision-making, and goal-setting. It's amazing how much you can learn from a cookie.
Coping with COVID celebrates Women's History Month. Carter, the first African-American costume designer to receive a star on the Hollywood Walk of Fame. This famed designer is only the second in her field to receive such an honor. Spike Lee enlisted Ruth E. Carter's work on his movie School Days after seeing her at the Los Angeles Theater Center. She also costumed the original and new Coming to America sequel and received the honor of being the first African-American costume designer to receive an Oscar for her work in Black Panther. Ruth E. Carter, the first African-American costume designer to receive a star on the Hollywood Walk of Fame. Celebrating every woman. It's a Women's History Month celebration on Coping with COVID from Tailor Made Productions.
You're watching Coping with COVID, updates on the pandemic and information to help you thrive and survive COVID-19. We are so happy for all of our sponsors, brought to you by SCDHEC, Edit Together SC, the South Carolina Diabetes Advisory Council, the City of Columbia Office of Business Opportunities, Agape Counseling and Training Center, also Palmetto Media Connections, and I want to thank all of our new sponsors, Javis Tax Service, celebrating 20 years of providing financial services to South Carolina. Also, the Comet Bus Systems. Don't forget to shoot your shot and get your vaccine for free from the Comet Bus System. And Computers Unique in Dutch Square Mall. Contact Daniel for professional, reliable, and affordable service for your computer. Thank you so much to all of our Coping with COVID sponsors. Don't forget to like, share, post, and follow so we can get this message to the masses. SC Thrive is an organization that provides all South Carolinians access to quality of life resources, including food security, healthcare, financial wellness. And today, Brenda Blackstock joins us to discuss the Healthy Connections Prime program.
Yes.
For seniors 65 and older. Brenda, thank you so much for joining us. I appreciate it.
Thank you. Thank you for having me. I'm so excited. And I'm very passionate about seniors too.
Yes, that's so
Yes,
great. So
yes.
tell me, what is Prime?
Prime is a healthcare option for individuals who are 65 and older and have both Medicare and Medicaid. It
Okay.
combines the Medicare and Medicare services under the Prime umbrella.
Okay, all right. So it's for, like you said, seniors 65 and older who have both
Yes.
Medicare and Medicaid.
Mhm.
Why do they need this?
Listen, let me tell you, I have about over 15 years of insurance counseling. And there's one particular lady, I went to her house, bless her heart, she was so sweet. And I was like, she wanted to know what was the best option for her. We were in open enrollment. She had cards everywhere. This card, that card, this card. And I was like, Mother, what plan are you in? This is one of the reasons why I love Prime, is because for individuals who are on traditional Medicare and also have Medicaid, they will have one card for Medicare, which is the red, white, and blue.
Right.
They will have a prescription drug card for their Part D medications, and they will also have the Healthy Connections Medicaid card. So that's 3 cards.
Right.
Well, like this. So when they enroll into Prime, it combines all of those services under the
Wow.
Healthy Connections umbrella, and they will only have one card.
Wow, that is good, because I
Yes.
guess it's really about being more convenient option.
Absolutely, absolutely. And then another reason why I do love the Prime, it's because it specializes in tailoring the care for the individual. Let's just say your mother is on Prime, or one of your loved ones is on Prime, and they had a fall. And maybe they're at home, and now they're going to need maybe some home delivered meals. They're going to need some therapy, things of that nature. The Prime does all of that. And then for another individual who he or she might be depressed or have issues with not taking their diabetes medications, the Prime would adjust for that person. And so the Prime program, it tailors the care for the individual. I love it about the program. Yes.
No, I was going to ask, now, when you say it tailors it, what does that mean exactly? And I'm going to tell you, I have an aunt that just passed away last week, and she was just having some challenges. I really wish I had known about this, because And she had been dealing with illness. She had been sick for a long time. So she had COPD. And that one of the issues were, I mean, you go to multiple doctors, and then, you know, are the multiple doctors talking to each other to figure out, does she take this? Does she take that? Are they clashing? And then, of course, when she went in the hospital or went into the nursing facility and eventually into hospice, you know, it was just trying to figure out with her girls, what was the best choice. I mean, there's, you know, listen, I think we're in a generation that we're dealing with caring for our loved ones who are elderly. And you just don't know what to do, girl.
you don't know what to do. One of the slides, this is another unique thing about the Prime program, is that the individual, the beneficiary, they have a care coordinator. And you can go again.
Okay. Here. No,
I think it's anyway.
Yeah.
Right there.
Yes. Okay.
Yes.
Okay.
They have a care coordinator, and that individual, the lady in the pink, bless her heart, she coordinates all of the primary care provider and the specialist, if they're a social worker, even the family caregiver, the person who is actually providing care for the individual that's on who is enrolled in Prime. So the care coordinator, she works with all the providers, anybody who's associated with the care or that can contribute to the health or the healing of the individual that's in the plan. It's like an orchestra. It comes together with a beautiful symphony. She makes sure that all of the care is coordinated. They communicate. This is a true story. My father, I wish that I could have put him in. I wanted to put him on the plan so much, but he's a diabetic, and so I hadn't seen him for like a couple of weeks, and when I saw him, he had lost so much weight, and come to find out, he was taking his diabetes medication, and also another specialist prescribed him another medication. Well, he had an allergic reaction, and he was dropping weight like crazy.
Wow.
Now, had he been on Prime, that care coordinator, she would have caught that. Right. Because she keeps up with all of the medications, and, you know, taking all of those medications, you can create a cocktail for disaster.
Yes.
You know? And so that is the benefit of the Healthy Connections Prime program. That care coordinator, she works with all of the providers. Any person that is has anything to do with the beneficiary's care, she is going to help coordinate it. And so coming together and communicating, you can tailor the care. That's how the care is tailored to the individual. When you use the example about your aunt, had she was on Prime, all of the providers would have been talking and communicating together, and especially the family, because who else knows what's going on firsthand than the family that lives with that individual. They can say to the doctor, listen, I noticed that mommy she's not eating. You know, she seems sort of extra lethargic, just whatever. And so the Healthy Connections Prime, I love this program. I am so very passionate about it, because when you put all of the pieces together, you don't lose anything, and actually you gain extra benefits.
Right.
And so another key thing about the Prime as well, let's just say the individual wants to apply for, or they may need some community long-term care. Sometimes an individual, they're at nursing home level of care, but they do not want to go into a nursing home. Guess what? On the Prime, they can pull that community long-term care benefit in without all of the paperwork. That's another thing when it comes to social services. There's a lot of paperwork involved.
Right. Yeah.
The care coordinator, they take care of all of that, you know? And so it's a beautiful plan. And bringing all those things together, you still get you've got one card, no co-pays, one plan. And I mean, no I love the word FREE. Free. You're still getting your prescription drugs. You're getting your even your eye care and even dental. You even get a dental benefit. Yes, $750 dental benefit.
So if you have Medicare, Medicaid, you
Yes.
apply for Prime, and
Yes.
automatically all of these services are
Yes.
afforded you.
Yes,
right?
everything the same services that you see, the doctor visits, the adult dental, it pulls it over into the new benefits to equal one plan, one card, one point of contact, no insurance premiums, no co-pays. You've got that Quercetin and that what I love, the personalized care plan. And all of this equals the right care at the right time in the right place. Yes.
So will someone contact you, will call you and say, I'm your personalized care team member or whatever?
Yes.
Okay.
When you actually get enrolled into the Prime program, you will get a phone call. And actually, when you get enrolled, you will call to the plan. And then the plan will actually put you in touch with your care coordinator. Yes.
All right. And people, of course, can call this number 800-726-8774. Now, is this available in every part of South Carolina, Brenda?
Actually, right now, the only two counties that it's not in is York and Lancaster.
Okay.
I'm so excited that Horry and Dorchester County and Darlington just signed on. I'm very excited about that. So we just got two counties left. But anywhere other than those two counties across the state, if you are an individual who is 65 and older and have both Medicare and Medicaid, that's dual eligible individuals. If you want to participate in the Prime program, you can give me a call, or you can call our office at SC Thrive. 800-726-8774. If somebody's there at the contact center, you can tell them that Brenda Blackstock told you to call, and they will get you enrolled into the Prime plan. Yes.
All right. So people just need to call, as you say. Can they also go to the website?
You can go to the website. Absolutely. You can go to our website at scthrive.org. And if you not only go into our website, you can enroll in Prime, but if there's any other benefits that you might need, maybe you might want to enroll in SNAP. Maybe you might need some help with WIC. Yes, Medicaid. If you want to register for some mental health first aid trainings, we have a list of trainings that you can enroll in. Everything is at the fingertip on our website, www.scthrive.org. Yes.
Yeah, we're looking at the website right here, and
Yes.
I do see people can apply for benefits, feed your family, file your taxes, financial health, get health care coverage, also military and veteran, and all types of benefits.
All types of benefits.
Yeah, at SC Thrive. I love that. It's kind of like one-stop shopping.
It is. It's a one-stop shop. And let me just get a plug in, since now we're in tax season. We also assist people free, FREE, because we're in COVID, we actually we can't do the in-person help. But if you call our contact center and just say you need assistance with your taxes, somebody will direct you in the right place.
That's great. This is SC Thrive's mission is to lead South Carolinians to stability by providing innovative and efficient access to quality of life resources, including food security, healthcare resources, and financial wellness through work supports. And as you can see, we're looking at the website right now. You can find a site. You can apply via Thrive or apply
Thrive Hub.
On the phone.
Thrive Hub. Yep. Thrive Hub. If you go to the site, it's our online web tool. And let me tell you what I love about the Thrive Hub. You can actually apply for SNAP, one of the Medicare savings programs, Medicaid. You can apply for all of these programs at one time, and with one click of the button, boom, send your application to all of those agencies at one time. Yes.
Wow. Yeah, we see right there the Thrive Hub. As you can see, you can go ahead and log on and get the information you need from SC Thrive.
SC Thrive.
So as you say, this the healthy The Prime program is for seniors 65 and older, as
Mm-hmm.
long as you have Medicare, Medicaid. Now, if people are just now signing up for Medicare and Medicaid during this, open enrollment period, can they still apply? Can they still qualify, Brenda?
Yes, but they have to. I would suggest for an individual, go ahead and apply for the Medicaid, and that's full Medicaid. Apply for the South Carolina Healthy Connections Medicaid card, and once you receive your card, then you can enroll into the Prime program. Yes.
Okay. All right. Great.
Yes.
scthrive.org. I think the phone number is up on the screen. Anything else we need to know about this program, Brenda?
Yes. You can enroll at any time.
Okay.
Yes, you can enroll at any time, and I'm the advocate. And what my primary job to do as an advocate, once you enroll, if you have specific questions regarding your plan, just questions in general, getting settled in. Some people, they are passively enrolled into the Prime program, and so they're like, they get the card and like, oh, what is this? What's going on?
Right.
I was in the grocery store. I was in Walmart one time, and I ran into a lady just by happenstance. She knows that I help people in the community. Yeah, in the grocery store, they get me. Yeah,
that's good.
Good. Yeah, and she was like, oh, there you go. And she was like in her pocketbook, and she was like, I got this in the mail. I don't know what it is. And then her father, he was ill, and she was like the caregiver, and she's thrusted into this position, not knowing where to go, what to do.
It's hard.
It is. And so when she showed me that card and I saw that Prime on there, I was like, girl, I said, you've got the golden ticket. With this card, with this plan, you can actually get the tailored care for your dad like you need. I said, here's my card. Give me a call and we'll talk about it later. So as a Prime advocate, if you have any questions about the Prime, how it works, what is it? I mean, what's available for you, do give me a call. And if you have problems with getting services regarding your Prime, I am your advocate. I literally work for you. Yes. So my number is area code 803-683-1678.
All right, 803
683-1678. Yes.
You see the information on the screen for Brenda Blackstock with SC Thrive. And the good thing about Prime, as you said, it's free. It's free to join. No additional cost, no additional premiums. If you've got Medicare and Medicaid, you qualify. You're 65 and older. And go ahead and get this excellent resource. Again, if you are that age or are dealing with someone that age, you know how challenging it can be to coordinate all of that together. So so please call Brenda if you need some information. Brenda, so glad you were able to come back on.
Thank you.
And thank you so much for what you're doing in the community. This is such good work. This is such important work. And I appreciate you. All right, Brenda Blackstock, go ahead. Were you going to say something?
I want to say thank you to you too. I love this. Oh, I love this show.
Thank you.
I love it. Oh my God. Thank you to you.
Thank you so much. Thank you so much.
Brenda, and I have a gift for you too. I'm sorry. I do have a gift. I've got a blanket for you, SC Thrive, and I got some socks. And so I got to get that stuff for you. Thank you.
Look forward to it, girl. All right, Brenda Blackstock with SC Thrive. Please contact her. Her information is on the screen. Again, if you have Medicare, Medicaid, or know someone who does, Prime is a free service to help you coordinate all of your services. Again, the information.
Can I say one more thing? I'm sorry.
Yes.
And also, do let me say this. Next Tuesday, March 16th at 11 o'clock, I will be hosting a primetime webinar. And our guests are going to be Dr. Linda Bell. She's our state epidemiologist. Yes. She's going to be on the show talking about giving us COVID updates and talking about the vaccines. And I'm also going to have Miss Florine Lennon. She is the state diabetes core group director, and she's going to be giving a wealth of information to individuals who have diabetes and they need to know how to eat healthily, proper ways of taking their medications and things of that nature. And so we're going to have door prizes, we're going to have fun, and so please email me I should have put the link down below, but if you would contact me on my email, okay, I will definitely send you an invitation.
Brenda, if you send me that flyer, we'll definitely post and share it on the show and on my personal social media. Okay,
I sure will. I'll get it out to you.
Absolutely. Yes. Thank you, Brenda Blackstock with SC Thrive. Thank you so much.
So very much.
Appreciate it. All right. Thank you again so much for joining us for Coping with COVID, updates on the pandemic and information to help you thrive and survive COVID-19. As you know, it's brought to you by SCDHEC, the City of Columbia Office of Business Opportunities, In It Together SC, the South Carolina Diabetes Advisory Council, also Agape Counseling and Training Center, Palmetto Media Connection, our brand new sponsor. So glad to have Javis Tax Service, 20 years of providing financial services to South Carolina. The Comet Bus System, offering free rides to get your vaccination, shoot your shot, and Computers Unique Sales and Service. Contact Daniel at Debt Square Mall for reliable, trustworthy, and dependable services on your computer. Sales and service, Computers Unique. Listen, if you have a story or initiative that could help someone cope with COVID, please go to my TailorMade production page on Facebook and inbox me. I would love to talk to you about highlighting you on coping with COVID. If you have a product or service that could help someone cope with COVID, please email copingwithtreitailor@gmail.com. You see the information scrolling on the screen. We would love for you to be a proud sponsor, just like all of our sponsors here on Coping with COVID. Tomorrow, it's Faith Friday, and what a story. Tre Tailor was blind, and she still plays and directs her church choir. She is amazing, and she just wrote a book, and we are going to talk to her tomorrow on Faith Friday. Next week, Wellness Wednesday from In It Together SC and the Diabetes Advisory Council. It's Kidney Disease Prevention Month. We're going to talk with Barry Walker, the mayor of Irmo, about his diagnosis, and also talk to some physicians with DHEC about kidney disease. And then next Thursday, we're going to get some Columbia, South Carolina updates from Columbia City Councilwoman and mayoral candidate Tamika Isaac Devon, and then from the county City Council County Councilwoman Gretchen Barron. We're going to talk to them coming up next Thursday on Coping with COVID. I hope you'll join us. As usual, I leave you with a reading from Jesus Calling. Today, March 11th, Jesus says, "Walk by faith, not by sight." As you take steps of faith, depend on me, and I will show you how much I can do for you. If you live your life too safely, you'll never know the thrill of seeing me work through you. When I gave you my spirit, I empowered you to live beyond your natural ability and strength. That's why it's so wrong to measure your energy level against the challenges ahead. The issue is not your strength. It's my strength, Jesus says, and my strength is limitless. By walking close to me, you can accomplish my purpose in your life with Jesus said, with his strength. That's your Jesus Calling for today, Thursday, March 11th. I'm Tre Tailor. Thank you again so much for joining us today. Until the next time, I wish you peace and abundant blessings. Please be careful, stay safe, and you still need to wear your mask, whether you got your vaccine or not, over your nose and under your chin. See you guys.
Coping with COVID, updates on the pandemic and information to help you thrive and survive COVID-19. It's brought to you by the South Carolina Department of Health and Environmental Control. Visit scdhec.gov for an updated list of testing sites and important information on how to protect yourself, your family, and friends from the coronavirus. SCDHEC, healthy people, healthy communities. In It Together and the South Carolina Diabetes Advisory Council, presenting Wellness Wednesday every Wednesday on Coping with COVID. The City of Columbia Office of Business Opportunities, helping to meet the needs of small, minority, and women-owned businesses in the City of Columbia. Log on to columbiasc.net/OBO. Agape Counseling and Training Services. Call 803-779-2777 for licensed professionals of counselors and social workers helping families, engaged and married couples, and individuals of all ages gain an understanding of all aspects of their lives. If you're having a challenge coping with COVID, contact Contact Agape Counseling and Training Services at agapects.com. And Palmetto Media Connections, connecting media and communities together. Coping with COVID, brought to you by SCDHEC. In it together, the Diabetes Advisory Council, the City of Columbia Office of Business Opportunities, Agape Counseling and Training Center, and Palmetto Media Connections.
Coping with COVID with Tre Tailor.